Kicking it off with Michelle.
It's truly a wonderful afternoon to be here in Harlem. I can say, I called Vanessa about half an hour ago and I said, Vanessa, I had to get off the train because I live out in Brooklyn. I live in an area called Canarsie in Brooklyn. So the 2 trains was just, it was just, I guess it was just normal 2 train today. You kept having delays and then someone actually pulled the emergency cord. I said, that's it. So I got off at 42nd Street, called Vanessa and I said, Vanessa, I am on my way because today truly, truly means a lot to me, heartfelt. In fact, I'm in awe. I am thankful for the collaboration. You know, Ingrid is not here, but her staff is here. I truly, truly do thank Iris House. Dr. Hill, I know you're in the room. You was just in the room. This is a collaboration. It's so meaningful because for many years, you know, when we see the acronym Gay Men's Health Crisis, we think it's, you know, this is an organization that just helps gay men. Yeah. My first level of work, programs and services outside of the medical, I received my medical and community healthcare network for quite a period of time, but I gotta say, as an immigrant, and I'm standing here today speaking as an immigrant woman because I would be amiss if I don't really speak about some of the needs that's still going on with immigrant women, and we're going to be talking about the Affordable Care Act, but I just need a little bit of help for us to look at where immigrant women lies within this aspect. If we're going to be talking about women, I would be amiss again, as I said it, you know, without not putting that plug, talking about the needs that we are having. So, Dr. Hill, I thank you all again for the work that you continue to do with women. Thank you all for the services from every PWA woman that I know. When we walk through those doors, the sincere help that we are getting. So I thank you all for this collaboration. You know, as Ms. Fields, you know, pretty much made the introduction, and you know, she talked about, you know, Michelle, and you know, a lot of times, in fact, you know, we hear, you know, of the different, you know, levels of work and the different, you know, areas that we got involved in. And I have to say, in fact, truly, out of me becoming involved in any level of advocacy work, my first line of work that I got involved in was actually really looking at research work and how drugs became developed, because here I was raising a perinatally infected child, and when her doctor looked at me and said, you know, at the age of 2, this child, she's not going to seroconvert, Michelle, she is infected, we have done the confirmation test. And he looked at me and he said, the good news is I'm going to be taking care of your daughter to the best capability, but the bad news is we don't have drugs to treat these children.
I remember.
You know, and to God be the glory, she's 22 today. She turned 22, June the 14th. And this child is 22. I'm seeing Deborah in the back of the room and she's saying, what, Raven is 22 now? Yes, she's 22. You know, God is still in the blessing business. So my advocacy work, and I gotta say, I learned from some of the best advocates, because when you gotta sit amongst clinicians, you know, and you gotta be able to level the playing field and say to them, look, I'm not here just because I'm living with HIV. I'm here because I'm fighting a battle for myself and my child. And that's the theme that I've gone on with throughout the years, because now I can tell you guys, I left her in Albany this week doing some work. She's on the battlefield now, fighting her battle for youth, and she continues to do the work because I've raised her. We have zero tolerance towards stigma. It's real, but we don't sit back and just talk about it. We do something about it. Every opportunity, I have raised this child that we can educate someone, because people are still walking around with fears. People are still refusing to understand this is a disease. It's about humans. It's about human lives. And, you know, the words that I echo, you know, from Raven, you know, she always tends to say, Ma, we have a disease that we didn't have any control over. What we know today in 2012, as women, you know, children being born, I mean, look at in New York, we have less than 1% of children being born today with HIV. Right. You know, and this came about because we collaborated. That's right. We got together with decision makers, those of us living with the virus, and we leveled the playing field. But the work continues. So again, as I started earlier on and I talked about my work that I'm doing right now in the community, you know, the NAHAS, you know, the National HIV and AIDS Strategy, you know, and the Affordable Care Act has opened the doors, absolutely yes, for those of us who are positive. But